Psoriasis is a devastating disease for many patients, and it causes massive problems for their quality of life.
And in many cases, it is difficult to treat.
Although we have a lot of treatments, a lot of them do have significant side effects. We now think we have a new treatment that doesn't have any of the side effects.
I have been very impressed by the positive results achieved with Soratinex.
I'm Professor Tony Chu. I've been a consultant dermatologist for 35 years and have had a lot of experience with psoriasis.
My name is Benedetta Brazzini. I'm a consultant dermatologist both in London at Ealing Hospital and in Florence, Italy.
Psoriasis is in fact a relatively common condition. It affects about 5% of the population, and it's a chronic inflammatory condition. What effectively happens is the body reacts to something, and we still don't know what it is, and the immune system causes the skin to overreact. And so you get inflammation, so redness. The skin cells start growing far too quickly, so normally a skin cell will take 6 weeks to grow to the surface and then die and fall off. In psoriasis, it's 6 days, so you get a build-up of dead skin and scale, and so what you're left with are red patches on the skin that are very scaly.
There are many treatments for psoriasis. There are topical treatments and systemic treatments. The main topical treatments are based on the use of steroids and vitamin D.
Psoriasis is a very ancient disease. If you look at the first descriptions of psoriasis, they were actually present in the Jewish Bible, and this described people with scaly skin being put into leper colonies, and it's because it looks infectious. And these days, psoriatic patients will still tell you they feel like latter-day lepers.
It is a very debilitating disease for patients. It can affect their social life, their working life.
The impact on quality of life is massive. It can stop you wearing the clothes you want. If you've got it in your scalp, you can't wear dark clothing. If you've got it on the body, you want to cover it the whole time. Although we don't agree with it as dermatologists, probably the commonest topical treatment is with a topical steroid. And of course, steroids can cause problems because they can thin the skin, they can actually get absorbed into the body and cause problems within the body itself. I first heard about Soratinex from Dr Brazzini. She gave me a call and said she'd heard about this new herbal treatment for psoriasis from one of her mentors in Italy, Professor Lotti. And Professor Lotti has spent a lot of time putting together data from the whole of Europe on trials using this particular preparation and with extremely impressive results.
After speaking to Professor Lotti and reading the results of the studies that had been carried out over Europe, Professor Chu and I were very intrigued about this new treatment. So we decided to carry out our own trial to prove the efficacy and also explore the possible side effects of this new treatment.
The trial was an open study, and so we recruited patients in London, and we used 2 measurements. One was a severity index called the PASI score, looking at the extent and the severity of the psoriasis, and the second was a measure of the quality of life called a DLQI. And we looked at patients at time 0 when they first started this trial, at week 4 and then at week 8, and we compared the readings at those 3 visits.
At the end of the study, we were extremely impressed about the results. We saw that over 60% of our patients achieved an improvement between 50 and 100% of their psoriasis, both in the severity but also an improvement of their quality of life.
We had some fantastic results with patients who had had psoriasis for many years, who had failed on all sorts of treatments, who did extremely well.
At the beginning, I was extremely skeptical about the efficacy of this treatment, but after the trial I was convinced that actually it really works and can have fantastic results.
With any trial, if a product is really good, you expect 50 to 60% of patients doing well with it, and we did extremely well. 60% of our patients had at least a 50% reduction of their severity score and also a reduction of their DLQI, so the quality of life had improved enormously. Patients generally saw improvement very early, so by the 4-week first visit, we already saw patients improving significantly.
One patient had extremely severe plaque psoriasis. He had had it for over 15 years. He had phototherapy and then he had methotrexate. Unfortunately, he did not respond to phototherapy. He started treatment with methotrexate but had to interrupt because decided to start trying for a family. At this point, I thought it was a good idea to try him on Soratinex without giving him much hope. To my surprise, the psoriasis cleared, and now the patient is still clear from psoriasis and using Soratinex as maintenance.
Obviously, a major positive is that it does not contain steroids. It's completely safe, and in all the trial data throughout Europe, there have been almost no side effects whatsoever. So that's a definite plus.
We are now very confident that this is a very important and promising alternative topical treatment for patients with psoriasis.